Sarah, a 25-year-old woman, has been experiencing auditory hallucinations for the past few weeks, hearing voices commenting on her actions and telling her to harm herself. Despite reassurances from her family that the voices aren't real, she remains convinced of their presence. Question: based on this scenario, what symptom of psychotic disorder is Sarah experiencing? A. Delusions. B. Disorganized thinking. C. Hallucinations. D. Apathy. C. Hallucinations. Sarah is experiencing auditory hallucinations, which are false sensory perceptions that occur without any external stimuli. John, a 40-year-old man, believes that his neighbors are plotting against him and trying to harm him. He has started avoiding leaving his house and spends most of his time monitoring his surroundings for signs of danger. Question: which subtype of psychotic disorder is John most likely experiencing? A. Paranoid schizophrenia. B. Disorganized schizophrenia. C. Catatonic schizophrenia. D. Schizoaffective disorder. A. Paranoid schizophrenia. Explanation: John's belief that his neighbors are plotting against him is characteristic of paranoid schizophrenia, which involves prominent delusions of persecution or grandiosity. Emily, a 19-year-old college student, has recently started experiencing disorganized thinking and speech. She often jumps from one topic to another during conversations, making it difficult for others to follow her train of thought. She also exhibits inappropriate emotional responses. Question: what symptom of psychotic disorder is Emily primarily displaying? A. Hallucinations. B. Negative symptoms. C. Disorganized thinking. D. Delusions. C. Disorganized thinking. Emily's disorganized thinking and speech, along with inappropriate emotional responses, indicate disorganized symptoms of psychosis. Mark, a 30-year-old man, has been using methamphetamine regularly for the past 6 months. Lately, he has been experiencing paranoia, believing that people are following him and planning to harm him. He also hears voices when he is high on methamphetamine. Question: what type of psychotic disorder is Mark most likely experiencing? A. Schizophrenia. B. Substance-induced psychotic disorder. C. Brief psychotic disorder. D. Delusional disorder. B. Substance-induced psychotic disorder. Mark's psychotic symptoms are likely induced by his methamphetamine use, making his condition a substance-induced psychotic disorder. James, a 22-year-old man, has been experiencing a decline in his academic performance and social functioning over the past year. He often isolates himself from his friends and family and struggles to find pleasure in activities he used to enjoy. He also lacks motivation to pursue his goals. Question: which category of symptoms is James primarily displaying? A. Positive symptoms. B. Negative symptoms. C. Cognitive symptoms. D. Affective symptoms. B. Negative symptoms. James is primarily displaying negative symptoms of schizophrenia, including social withdrawal, anhedonia, and lack of motivation. Maria, a 35-year-old woman, has been admitted to the psychiatric hospital after experiencing a sudden onset of psychotic symptoms, including hallucinations and delusions, for the past 2 weeks. She has no prior history of mental illness. Question: what type of psychotic disorder is Maria most likely experiencing? A. Schizophrenia. B. Brief psychotic disorder. C. Schizoaffective disorder. D. Delusional disorder. B. Brief psychotic disorder. Maria's sudden onset of psychotic symptoms with no prior history of mental illness is characteristic of brief psychotic disorder, which lasts less than 1 month. Tom, a 50-year-old man, has been diagnosed with schizophrenia and has been stable on antipsychotic medication for the past 5 years. However, he has recently stopped taking his medication because he believes that he no longer needs it, and that he can control his symptoms on his own. Question: what term best describes Tom's belief about his medication? A. Hallucination. B. Delusion. C. Disorganized thinking. D. Apathy. B. Delusion. Tom's belief that he no longer needs medication and can control his symptoms on his own is a delusion, specifically a delusion of control or influence. Sarah, a 28-year-old woman with schizophrenia, has been attending weekly therapy sessions with a psychologist. During therapy, she learns coping skills to manage her symptoms, improve her social skills, and set goals for her future. Question: what type of intervention is Sarah receiving? A. Pharmacotherapy. B. Psychoeducation. C. Cognitive behavioral therapy. D. Vocational rehabilitation. C. Cognitive behavioral therapy. Sarah is receiving cognitive behavioral therapy, a type of psychotherapy that helps individuals with psychotic disorders manage symptoms, cope with stress, and improve functioning. Jason, a 24-year-old man with schizophrenia, has been experiencing persistent negative symptoms despite being on medication. His psychiatrist recommends a program that provides support with finding and maintaining employment, housing, and social relationships. Question: what type of intervention is Jason most likely being offered? A. Family therapy. B. Assertive community treatment. C. Dialectical behavior therapy. D. Electroconvulsive therapy. B. Assertive community treatment. Jason is likely being offered assertive community treatment, which provides comprehensive support with employment, housing, and social integration for individuals with severe mental illness like schizophrenia. David, a 30-year-old man, has been diagnosed with schizoaffective disorder. He experiences mood disturbances alongside psychotic symptoms. Despite taking his medication regularly, he still occasionally hears voices telling him that he is worthless and should harm himself. Question: what is the most appropriate term to describe David's condition? A. Bipolar disorder. B. Schizophreniform disorder. C. Schizoaffective disorder. D. Major depressive disorder with psychotic features. C. Schizoaffective disorder. Schizoaffective disorder is characterized by a combination of mood disturbances, such as depression or mania, and psychotic symptoms, such as hallucinations or delusions. Individuals with schizoaffective disorder experience both mood disorder and psychotic disorder symptoms. Rachel, a 20-year-old college student, believes that she is a famous actress and that the people around her are her adoring fans. She often dresses extravagantly and behaves in a grandiose manner, expecting special treatment from others. Question: what type of delusion is Rachel experiencing? A. Persecutory delusion. B. Grandiose delusion. C. Somatic delusion. D. Erotomanic delusion. B. Grandiose delusion. Rachel's belief that she is a famous actress and deserves special treatment indicates a grandiose delusion. Grandiose delusions involve exaggerated beliefs about one's abilities, identity, or importance. Michael, a 25-year-old man, has been experiencing catatonia, including immobility and mutism, for the past week. He does not respond to external stimuli and appears to be in a trance-like state. Question: what type of psychotic disorder is Michael most likely experiencing? A. Catatonic schizophrenia. B. Brief psychotic disorder. C. Schizoaffective disorder. D. Delirium. A. Catatonic schizophrenia. Michael's symptoms of catatonia, including immobility and mutism, are characteristic of catatonic schizophrenia. Catatonia involves disturbances in movement and behavior, often including immobility or stupor.